Good to go? Okay, good morning everyone, or good afternoon everyone. It is great to be here. We just concluded our Wednesday cabinet session. We're here in the press theater at the legislature on the traditional territory of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations. Today is 1 year since the first active case of COVID-19 was discovered in British Columbia. Since that time, we've seen tremendous upheaval, extraordinary changes in how we deal with each other and how our government presents itself to the people of BC, and more importantly, how we present to each other during these most unprecedented of times. Although that first case recovered, 1,100 people have contracted COVID and not recovered over the past 12 months. Please take a moment to reflect on the impact on those families as a result of COVID and the challenges we still face as we go forward. Although we are encouraged by the news of vaccines, a bit of a bump along the way with the supply we had anticipated coming this next week and the week after being shorted, but we do have a commitment from the federal government to get our first quarter allotment in total by the end of March. Despite the fact that vaccines have arrived, we have a long, long way to go. And I want British Columbians to reflect on how much they've sacrificed over the past 12 months and ask you to dig down a little bit deeper, find that extra gear to get through the next number of weeks and months as we get our vaccine program up and running. We've done a lot together over the past 12 months, and we've done it while we've been apart. We've done our level best to make sure that government can provide the services that people need. We focused on people, we focused on communities, and we focused on making sure businesses can continue to operate to the greatest extent possible, despite the public health orders put in place to protect people and to protect the most vulnerable in our communities. There have been challenging times as well in terms of personal behavior. We've seen extraordinary acts of kindness, and we've seen brutal acts of racism and violence against people for no particular reason beyond the color of their skin. Fortunately, those have been few and far between, and the examples that we can all point to as British Columbians of people acting appropriately as they would want someone to act towards them far exceed the numbers of cases of people acting badly. I think that's a result of how we all feel as British Columbians towards each other and how we would want others to treat us and our families as we come through this most extraordinary of times. I know there's lots of questions today. Every sector's been affected. There's lots of things to talk about. I just wanted to leave in this opening comment section, leave British Columbians with the knowledge that we are doing everything we can to keep them safe. You too have an obligation. The vast majority of British Columbians have stepped up to that obligation. We're speaking, Dr. Henry was speaking earlier in the week to that small group of British Columbians that think they're above everyone else. That small group of British Columbians, like those who travel to another jurisdiction to bump vulnerable people out of the lineup to get a vaccination. That is not the type of behavior the vast majority of British Columbians would expect from their neighbors, from their loved ones, and it's the last thing I expect as the leader of a government. I believe there's nothing more un-Canadian than going to another jurisdiction to jump the line because you have the means to do so. Those are the type of examples we want to put in our rearview mirror as we celebrate the kindness and the goodwill of British Columbians towards each other as we work towards the summer and the fall when we can get back to normal. That's my hope, that's my wish, and that's my focus for the next number of months. Happy to take any questions you may have.
Our first question today is from Binder Sajan, CTV. Are you there, Binder?
Hello?
Oh.
I'm not muted. Can you hear me?
I can hear you now, yeah.
Hello?
I can hear you, Binder.
Hello?
You can't hear us.
Binder, I think we can hear you. Go ahead.
Great. Premier, Manitoba has implemented a 14-day quarantine for anyone coming into the province due to concern around the variants. Alberta's provincial health officer also saying that might be a consideration. Why hasn't BC done something similar to this, and is this something that is being considered?
Well, we took a good look at the legal and other ramifications of bringing forward restrictions for non-essential travel. We discussed that briefly last week. Until such time as the public health officer advises me that there's a benefit to going down that road, we're going to leave it untraveled for the time being. That's not to say we won't go in that direction, but the differences between Manitoba and British Columbia, I think, are obvious to most people. There are 4 roads in and out of Manitoba. There are dozens of roads in and out of British Columbia. We have major airports. There is but 1 major airport in Manitoba. I've certainly been working with Premier Pallister and other premiers across the country on travel issues. These are important issues for British Columbians. The public health evidence is not there at this time. Dr. Henry assures me that when that evidence is there, she'll present it to me, and because of the work we've been able to do, we may be in a better position to take action at that time. What we want to focus on now is if you are coming to British Columbia on non-essential travel, I was going to say something that I'll pull back. You better behave appropriately. You better follow our public health guidelines, or we'll come down on you like a ton of bricks. If you're coming here for non-essential activity, you need to abide by the rules and regulations that all British Columbians are following.
Do you have a follow-up, Binder?
Yes, now I'm curious about what that comment was, but I'm wondering also, you spoke about the small minority of people who aren't following the rules. Even today, we're hearing from Vancouver Police Department about an officer who had a leg broken during an arrest of someone who refused to wear a mask. Just wondering what your reaction is to that, and also, do you think we need to do more on the enforcement side? I know we've got the $2,300 tickets, but is that enough of a deterrent for people?
Minister Farnworth, in his report to Cabinet today, talked about the challenges law enforcement are facing with those who just are disregarding the orders that are in place, disregarding the health and wellness of other British Columbians. This is disconcerting, and we're taking steps to ensure that the full force of the law comes down on those, particularly those that are violent, but particularly those that are also trying to find ways to circumvent the rules, to find loopholes. The notion of someone with a penthouse condominium in Vancouver declaring it a nightclub and not allowing law enforcement to ensure that they're living up to public health regulations. That's the type of behavior that Dr. Henry was talking about on Monday. We need people who are not paying attention to give themselves a bit of a shake and get with the rest of us, the vast majority of British Columbians, who are making extraordinary sacrifices every single day. We talk about COVID fatigue. It's COVID exhaustion. Let's be honest about this. People are frustrated, they're angry, and when they see other people disregarding the very rules that they're trying to abide by, it's offensive to them, it's offensive to me.
Our next question is from Richard Zisman, Global.
To pick up on what you just said there, we have a reporter in Whistler right now and has ran into a number of people from out of province who are looking for a party, as they describe it. So when you say you will come down like a ton of bricks, what is a ton of bricks?
Well, we're looking at, for example, ski hills. This is an area where the activity is not the problem. If you're on the Black Diamond Run at Whistler or Big White and you've got your mask on, you've got a helmet on, you're fully rugged up for the cold weather, you're not a prospect for transmission of COVID-19. So that the resort operators, the hill operators, are doing what they can to make sure that public health orders are being accounted for in the activity. It's when people leave the hill and look for the party that we're seeing transmission. And that's where we're very concerned. And that's where Dr. Henry and Minister Dix are looking at what the consequences are of those that are coming from away, as well as those, quite frankly, who are coming from downtown Vancouver or the island or any other part of British Columbia looking for a party. This is not the time to do that, and we have appropriate mechanisms in place to enforce those bylaws and those health orders, and Minister Farnworth's been doing just that.
Richard, do you have a follow-up?
You've alluded to this, I think, in your introductory comments, but I want to ask you, when Dr. Bonnie Henry asks people to do more, what do you say to those that are doing everything they can? And what more are you going to do to help British Columbians?
Firstly, in terms of helping British Columbians on the fiscal side, we've put $10 billion into British Columbia between budgets, which is unprecedented. Never happened in the history of our province. And in fact, we've seen that across the country. The federal government stepping up, making extraordinary investments in people to try and keep them safe, to try and keep them whole, whether it was putting in place rent supplements, as we did here in BC, the COVID benefit, which almost 1.6 million people have now received payments for that benefit to keep them going through the winter. We ask those people who have been making those sacrifices, we say to them, thank you. Thank you for doing that. Keep up the good work. Dr. Henry was talking to those that are not listening, and they have been in place for some time. You'll recall last summer I called on prominent British Columbians, noted British Columbians like Ryan Reynolds and Seth Rogen and Michael Bublé to make statements on their platforms to try and reach those people that were not listening to Dr. Henry. And we had some success there. What Dr. Henry's trying to get across is that we are not out of the woods. As much as the vaccines give us cause for extraordinary hope, when this hit a year ago, the expectation was that vaccines were 18 months away. Well, 12 months since the first case, and we've vaccinated 125,000 people, mostly the most vulnerable in long-term care facilities and the staff that work there. So we've made great progress, but we are not out of the woods. Our appeal to the public is to keep up the good work. Thank you for doing that. Together we can get through this.
Our next question is from Vaughn Palmer, Vancouver Sun.
Good day, Premier. In looking back over the year since that first case in BC, is there anything we should have done differently or should have done sooner?
Well, thanks for the question, Vaughn, and I suspect the answer was probably yes and yes. I don't have specific examples. I'm living in the moment in that sense. We are very proud of the work the professional public service has done to respond sometimes in a number of days to initiatives that would normally take months to put in place. I'm very, very grateful to those frontline workers, not just our heroes in healthcare, but those on the front lines when our supply chains were stretched, the truckers, the people working in food and beverage who kept going to give some hope to people going forward. There will be, I'm sure, reports in the months ahead that will criticize and second guess the steps that we've taken, and I take full responsibility for that. But at this point, the reviews have been fairly positive. I don't want to anger Twitter, but by and large, British Columbians appear to be satisfied with the direction we've gone. We've been as inclusive as we possibly can be with the business community, with labor, with not-for-profits, with Indigenous peoples. We've accelerated the level of consultation that, again, unprecedented. And that's because people are willing and prepared to put aside previous differences and focus on what they can do for their business, for their community, for their families. And at this point, I'd have to say we've met the test, but there will be examples. I'm sure, Vaughn, you may have in your supplementary question one of those examples. But for now, I'm pretty satisfied with the effort that's been put in, without a doubt. And there will be examples over time, and we'll deal with those as they come up.
Vaughn, do you have a follow-up?
Yes, please. I was struck listening to Dr. Henry on Monday that, her usually optimistic outlook. She seemed to be a bit more pessimistic. Maybe it was the news about the delay in vaccine shipments or some of the bad behavior here. You, Premier, have generally maintained an optimistic outlook. Has anything shaken your confidence in that so far this year?
Well, yes, and the most recent example was on Friday. I said that in my Canada, people would step to one side to give a vaccine to someone that was more deserving of it or in more need of it. And 72 hours later, we hear about the entitled and the elite chartering a private jet to bump someone else out of the queue. That's about as un-Canadian as you can get, and that was profoundly disappointing for me on a number of levels. You can't measure the contempt I think British Columbians have for that individual taking those steps. Over the Christmas holiday, some public officials, not any in the BC legislature, but some public officials deciding it was a good time to travel after we appealed to people to stay in place. That was disappointing. But I have to say that I think our federation has worked better than it's ever worked before. Is there areas of improvement? Absolutely. But we've had, and I always miss the number, the Prime Minister reminds us every time we have a call, we're heading towards 30 meetings, substantive meetings between heads of government across the country since March of last year. That's unprecedented, and that gives me hope that this crazy thing called Canada, large land mass, small population, multiple ethnic backgrounds, Indigenous populations, and 2 official languages, we can continue to make it work because we all know and understand that we're very fortunate to be Canadians. And having the examples of the past 4 years in the United States has reinforced that, I think, for all of us, that we're very grateful to live above the 49th parallel, except for us in Vancouver Island here are below the 49th parallel. But you get my point, Vaughn. I think I'm inspired by how Canadians have responded in this extraordinary time. Are there bad actors? There sure are, and that's disappointing. And I know Dr. Henry, I mean, let's walk a mile in her shoes for a minute. Not only is she regularly available to talk to you and countless others, but she's in touch with health officials, not just across Canada, but around the world, keeping up on literature, reading into the night so that we are as on top of these issues as we can possibly be. So I'd cut her some slack if she was a bit grumpy on Monday. She has been an absolute rock for all of us, and I think the vast majority of British Columbians feel that way.
Our next question is from Rob Shaw, CHEK News.
Hi, Premier. The Prime Minister has suggested there are new restrictions coming on travel. He sort of hinted to Canadians not to go outside on holidays out of the country for fear they might not be able to get back in a timely manner. You're talking to him fairly regularly. Have you asked him specifically to do anything? What have you suggested to him that BC wants to see on that?
Well, I called some months ago for a pan-Canadian approach to interprovincial travel. And the Prime Minister, in his most recent comments over the past couple of weeks, has been appealing to all Canadians to stay in place. If you don't need to travel within your province, certainly stay where you are. And if you don't need to travel outside of your province, stay where you are. So I'm grateful that the federal government's showing leadership in that regard. When it comes to our international borders, we worked very aggressively at the beginning of the pandemic because of our proximity to Washington State, where there were a series of outbreaks. We were aware of them very early on because the first case we had here and how Dr. Henry and Public Health got on top of this in January, whereas other provinces were looking into March. So the federal government has been very responsive to our concerns about international travel. And I know that Premier Ford and Premier Legault, particularly, where they've seen starting to level off, but high spikes in cases as they're getting towards the spring break. We don't have the same concerns about spring break where we have seasonal temperatures, but for those living in the heartland of Canada where it's cold today, I can understand they'd want to look at another place to go, but they need to stay home, and the Prime Minister has been focusing on that. If there are new travel restrictions internationally, BC stands ready to work with the federal government to implement them here in BC.
Rob, do you have a follow-up?
Yes, please. You've been trying to present a united front with the federal government. I noticed you passed on criticizing them for the vaccine shortage, talking about the cooperative federalism that you've seen so far. Your government got blindsided in an op-ed by the federal digital minister saying that there are people whose lives are being lost in BC because the government won't sign up for the COVID-19 app. I wondered what you made of that criticism in light of you trying so hard to present this united front to people.
Well, I can only be responsible for my own behavior, Rob, and I believe there is zero benefit to British Columbia complaining about disruptions in European logistics that are preventing us getting our vaccines next week and the week after. 0% in that. I've been pretty clear on the app. The advice we're getting from Dr. Henry is nothing replaces the gumshoe work of contact tracing. The proof is in the pudding. British Columbia, although the numbers are unacceptably high and have been over the Christmas period and into today in the 400, 500, 600 range, We have been doing a good job in containing community outbreaks using contact tracing. The apps that the federal government have been promoting for months and months do not meet the needs of public health here, and until such time as they do, we're going to continue on the path that we're on. If federal ministers want to take shots at me, I'm good with that. I don't see any benefit to anyone of doing that, however. We've had measurable success in British Columbia following the path that we're on, and I would encourage that minister to rethink her approach to building a stronger country by putting 700 words together that may have felt good at the moment she hit send, but don't do anything to advance the well-being of Canadians.
Our next question is from Zara Premji, CBC.
Hi, yes, Premier, you mentioned you think there are too many ways to get into BC to make a 14-day quarantine rule effective, but don't you think implementing that in BC could be considered a deterrent for people in other parts of Canada who might be planning a trip here?
Well, if it's deterrent that we're looking for, I think that saying quite clearly that if you come to British Columbia, you have to abide by the rules here in BC. If we see through public health that an increase in the number of people from outside of British Columbia is contributing significantly to the increase in community outbreaks, we'll take action. We did the legal work. We know what we would be required to do to put in place restrictions on internal travel, but we don't believe it's necessary at this time. I appreciate that Manitoba is going in that direction. Per capita, their case counts are frightening, and I can well understand why they would want to do that. One highway from Ontario in, 4 highways into Saskatchewan. That's it. We have one major city, one major airport, 5. No, that's them. We have one major region, 5 urban centers, major airport, 10 interprovincial airports, some 60 flights a day to YVR, 10 flights a day into Victoria, 27 interprovincial crossings. So it would be a logistical challenge. We had enough challenge with the international borders assisting the revenue services or the Canada Revenue Agency, border services, when we imposed the restrictions internationally. We brought forward dozens and dozens and dozens of provincial employees to help backstop the federal initiative. And that's their business. That's what they do every day, is monitor the border where there are checkpoints. We have no checkpoints in British Columbia, so logistically it would be a challenge. How would we monitor that? We have plans in place if we need them, and we'll follow through on that.
Zara, do you have a follow-up?
Yes, please. So the International Olympic Committee said today it's pressing ahead with the July 23rd opening of the Tokyo Summer Games. This would require our athletes and officials, of course, to have their double doses of vaccine. Any early indications of what BC's protocol would be for this, Premier? And would you support some kind of exemption so they could be fast-tracked?
Well, I have to say that I've received, it's now about 3 inches thick correspondence through snail mail and through email from organizations across British Columbia calling for an exemption to their sector. All very compelling arguments, all legitimate points of view. We announced last week our vaccine plan that involves addressing the challenges by vulnerability, starting with age. So with respect to athletes who would want, British Columbia athletes who would want to participate in the 2021 Games in Tokyo, if they are over the age of 60, they would be in a good place to get vaccines. If they're not, we would have to hope for new vaccines to come on stream. And that is our hope at this time. There are 2 others, AstraZeneca and the Johnson & Johnson Janssen vaccine, that are very close to approval here in Canada, and that will change the game. As it is now, we've been focused on Pfizer and Moderna, those that have been approved, those that we have contracts with the federal government to get supply. So it's premature for me to suggest that BC athletes who want to participate in the Olympics could not expect to get their vaccinations. The plan today does not allow for that. As time goes by, we may be in a better position, but we're not today.
Our next question is from Lisa Eusden, News 1130.
Hi there, Premier. Talking about that long-term care report from October not being made public, I'm wondering how BCers are supposed to trust health or your government if the top health official says that he didn't even know about the report And Minister Dix said that they did act on the recommendations, but hundreds have died in long-term care since that report under the government's watch. So I'm wondering how people are supposed to trust that the right thing is being done.
Well, again, I just ask British Columbians to have faith that we're doing the best we can to protect them, to protect their loved ones, and to protect their communities. The Minister Dix spoke extensively on the report. It was initiated by the ministry. We've been acting on the ministry has been acting on the recommendations. This is a normal course of business issue, it seems to me. But Minister Dix was pretty exhaustive in his responses to your questions. I think I'll leave it at that.
Lisa, do you have a follow-up?
I do. You talked about the PHO talking to those who aren't listening when they're asking for people to do more, but they're not listening. They haven't listened all the way along. And I think you talked about the couple going to the Yukon. It's shown an appetite for people wanting bigger teeth, that these $2,300 and $230 fines seem to be less than a slap on the wrist. So, you're saying you're disappointed, but you have power to do more. Why are you not doing more to come down on these people, as you said, like a ton of bricks?
Well, as I said, we had our cabinet meeting today. Minister Farnworth, in his regular public safety update, talked about a number of issues that are a number of opportunities that are available to us to protect law enforcement, first and foremost, from belligerent British Columbians who are just disregarding their role in a civil society. And there are also those that are well off and believe that the fines, although substantial for regular people, are just not even a rounding error for millionaires who can charter jets to bump Indigenous elders off the list. I just don't know how we can compare people that would think that's okay with regular people, because that's just not how most of us roll. For those who disregard the rules, we're going to be taking steps to do what we can to make sure that they feel the pain of trying to get outside the box that all of us have been in, not happily, but all of us have been in with the focus on making sure that those we care about are safe.
Next question is from Justine Hunter, Globe and Mail.
Thank you. Hi, Premier. Even since you have received that legal opinion on domestic travel, and I know you haven't shared that opinion with us, so I'm just guessing what's in it. It seems to turn on the notion that there's no demonstrated risk to the health of British Columbians. But things have changed since that report came down. You've got the arrival of the variants, the delays in vaccine distribution. How can anyone say with confidence that these variants here do not present a risk to the health of British Columbians?
Well, we can't, and we're not. But what Dr. Henry says regularly is that we are doing our best to suppress community transmission using contact tracing to find where exposures have taken place and taking steps to isolate those individuals. We'll continue to do that. And if there is overwhelming evidence, I mean, Dr. Henry looks at this with her team. Again, I go back to the hours and hours that are spent analyzing data and making determinations on what steps we can take, what advice public health will give to government, and she'll continue to do that. There was not, last week, there was not evidence that interprovincial travel was contributing to a significant increase in caseloads. Activity in locations where people from outside of British Columbia have congregated, yes, but directly connecting all of those dots has not happened. So when that does, we'll be in a different position than we were when we got the legal opinion, and we'll take steps as required. Again, I want to stress people should stay home. As the Prime Minister has said, as premiers are saying across the country, don't travel unless you have to. That's our biggest hope, is that people will listen and they will abide by these rules that all British Columbians, or the vast majority, have been for months and months and months.
Justine, do you have a follow-up?
Yeah, just a simple one. Can you just clarify if the legal question was on a potential ban on travel, or was it just, as Manitoba has done, quarantine requirements for non-essential travelers?
It was a legal opinion that was presented to Cabinet, and I'll leave it at that.
We have time for one.
Give her another half question on that. I feel badly about that. Go again, Justine. Try another angle.
I'm just trying to get a sense of whether or not what Manitoba is doing is a reasonable measure based on erring on the side of caution. I don't know that Brian Pallister is saying there's evidence of risk. They're saying there is a risk, and we're not going to take that risk.
Maritimes did something similar at the beginning, and Newfoundland particularly, was able to ban travel, and that was upheld in their courts. So we've looked at those examples. We will look at whatever comes from Manitoba. They're in the early stages of this initiative. We reached out yesterday for more details, and we have not yet received them, but there will be more coming. Again, I just look at the logistics, not just the legalities, and the logistics are extremely challenging. The best course of action is for Jason Kenney, Scott Moe, Brian Pallister to say to their citizens in Western Canada, stay home. And again, I applaud the Prime Minister on that route now, and he'll be talking more, I'm sure, about international travel as the week unfolds or into next week. But when it comes to people from away coming here, we want to welcome you to British Columbia. Our visitor economy is critically important to us. Our tourism industry depends on people coming from away, but not today.
We have time for one more question today. That will be from Rob Buffum. Go ahead, Rob.
Oh, hi, Premier. Thanks for taking my question, and it relates to what you've been talking a lot about today. I'm just wondering, yourself and the PHO have been exhorting British Columbians to do more. Wouldn't there even be some symbolic value in implementing what Manitoba is doing? You've talked about all the different, border entries presenting logistical challenges, but wouldn't there be, even from a morale point of view, to show that the government is doing something extra to try and keep people safe?
Well, again, Rob, the challenge is how would we do it? And I'm just not the type of person that's going to say this is what we're going to set out to do, knowing that we're not able to achieve it in an appropriate time frame. We need to, travel restrictions at the front end were critically important to British Columbia. Those international travelers were bringing COVID-19 into British Columbia. We were able to suspend that at great cost to our tourism sector, particularly here in Victoria. And so we don't want to make symbolic statements. We want to make sure we're suppressing community spread. And that means following the orders that are in place. And Dr. Henry's appeal to British Columbians is, I believe, an example of the frustration she feels as we see extraordinary efforts by the vast majority of British Columbians and a handful of people deciding they're above everyone else. That's just not Canadian. It's not who we are. And it does a disservice to all of us and leads to appropriate frustration, not just from the general public, but from community leaders as well.
Do you have a follow-up, Rob?
I do. I'm wondering, beyond symbolism, as a practical matter, Family Day is coming up. Spring break isn't far off. We know people travel to Whistler, amongst other places, from across the country, and realistically, people will continue to do that, especially if there isn't an order in place. What's the likelihood going forward in the next several weeks that there will be tighter restrictions on an interprovincial basis, as you explore what Manitoba has to say as we go forward?
Yeah. Well, again, we're not ruling anything out. I've never said that. I've said we want to make sure that we can implement a program that would make sense to suppressing community outbreaks or community spread of COVID-19. We will be revisiting, Dr. Henry will be revisiting her orders on February 2nd. Cabinet will hear some new information on modeling and other information next week, and then we'll get advice from public health on where we go from there. But the orders are currently in place, and I think that people who are looking at Family Day as an opportunity to get away, I think this is an opportunity to break out another jigsaw puzzle and gather together and spend some quality time reflecting on how much time we'll have to ourselves once the vaccine program is completed and we get back to normal. For those my kids are no longer at home, for those who have kids at home, spend as much time with them as you can, because they're going to be out the door pretty soon, and that's critically important to all of us. So enjoy your Family Day with your family in your bubble.